Kia ora koutou katoa, welcome to this afternoon's briefing. Today I can confirm that there are no new cases of COVID-19 in New Zealand and there are no new old cases either. That means New Zealand's total number of confirmed cases remains at 1,153 and our combined total of confirmed and probable cases remains at 1,503. Today there is an increase of 5 in the number of people who have recovered from COVID-19, so that is 96% of all confirmed and probable cases. I'm pleased to say there are no additional deaths to report, and we have just one person in hospital in Middlemore Hospital, and that person does not require ICU care. Yesterday our laboratories processed a total of 4,882 tests, and our grand total now is 238,725 tests processed. I'd like to talk a little bit about the new app, NZ COVID Tracer. So, as you all know, formally launched today, was actually available on the Apple and Google stores from last night and continues to be able to be downloaded from there. It's something like a digital diary that people can use by scanning QR codes at locations that they visit, and those QR codes are based on the nationally used New Zealand business number. And just so people know what a QR code looks like, I have one here. That is a QR or quick response code. Many people will be familiar with them, but in case you're not, that's a QR code. This is not so if you've photographed it, that is not a real QR code. It won't take you anywhere or let you know that you have been here today. So I would encourage Kiwis to download the app, and our key public health controls, as you know, are to identify cases early by testing, then isolate those people, and then to identify quickly who their close contacts are and isolate and test those people as well. So the app is another tool in our toolbox to help us do that. And the faster we can do that, the more likely we are to contain and prevent any onward spread. If you've been using this new app and we need to trace your contacts, then you can agree if that information is made available to our team. The only information that's held at the Ministry, and that is only for the purposes of this public health contact tracing response, not for enforcement. So the only information that's held is that contact information that you provide when you register. Other information, including the record of where you have been through scanning the QR codes, is only stored on the phone and it is deleted after 31 days. It is up to you to share that information with the contact tracing team should you be identified as a close contact. So if you do choose to release your information, of course what that does is help build a picture of where you have been and therefore identify other people who may be close contacts of a case. There's been a lot of interest in the app already. I'm pleased to say over 92,000 people have already registered on the app. The Ministry of Business, Innovation and Employment is in the process of contacting some 800,000 businesses around New Zealand to let them know about the process for generating a QR code that is unique to their business number, and already 1,000 businesses have created the posters and they are getting new registrations at around 10 per minute. Just to point out that at this point the app does not replace but rather complements other actions that businesses are taking to record who has been on the premises. Subsequent releases of the app will have functionality that will allow people to not only be registered, but if there is a case notified, for a message to be pushed out to people who may have been in a particular business at a point in time when they may therefore be a close contact. There have, I understand, been a few wrinkles with the downloads and running the app this morning. Largely, I think on some Android phones, those are all being looked at. If you have any issues, let us know. The first update or ironing out any of the bugs will be released this afternoon. And we're also talking with those who have developed similar apps, like one being used locally here in Wellington, Ripple, to make sure that there can be connection between this app and theirs, and we will be working closely with them. So moving on to the World Health Assembly, which finished very early this morning New Zealand time. I think you'll all be aware there was a resolution agreed by all member states around the global response to the COVID-19 pandemic. One of the features of that has been of great interest is the agreement for an independent evaluation of the response, including the response by the World Health Organization and also by member states. For our part, we will of course be willing participants in any review. We're also particularly interested in the many other aspects of that resolution that were agreed, for example, around vaccines and supply chain, and we'd see an important role for us is not only to support international efforts, but particularly to work with our Pacific countries, Pacific Island countries and territories, to ensure that they have ready access to vaccine should one be developed, and of course that their supply chains for medicines and other essential equipment are strong throughout the response. That's all I have to start with, and I'm happy to take questions.
How much of a take-up of the app do you need for it to be a good enough complement to contact tracing?
Well, any uptake is good and helpful, but the more people that use it and download it onto their phones, the better, because it just gives us another way of making sure we have up-to-date contact details, and then of being able to push a message out to people if they are identified as a possible close contact.
What do you say to people that are quite concerned about privacy with the app?
Well, this has been a really key consideration, and in fact one of the reasons we have been very methodical and taken our time to get the app out for release. We've worked closely with the Privacy Commissioner, and as I say, the key thing here is the information about where people have been, and likewise in subsequent releases where there may be this Bluetooth functionality to share information with other Bluetooth devices. All that information remains on the phone. It is not sent anywhere. It is with a person's permission that they then share that information. So privacy has been a major consideration, and we recognise the real importance of making sure people are confident that their information is kept private.
You have the functionality to alert people if they have been near a COVID case. Can you explain the point of the app to me?
Oh, at this stage, the main point is to get people registered, downloaded with the app, and then it does have benefit to them because it helps with them maintaining a record of where they have been in a simple way. Most people know when they've been at home and who they've been with, or when they've been at work, so this is when they're visiting other premises, retail outlets, and hospitality venues in particular. There's a question over there.
In terms of the QR codes, we've heard from a couple of bars and cafes who've said it's a bit too complex to get a hold of those. Can you just expand a little bit more on the work that you're doing with businesses to help them get to that?
So I'm not familiar with the details of the process because MB have been working with us over the last few weeks to get that New Zealand business number converted into a QR code, and in particular because an NZBN relates to a single business that may have a lot of branches. There's been some work to ensure that each branch has a unique identifier. I think we're seeing that many businesses are already downloading the QR code and generating the posters. So if there are issues, then those businesses, for example bars, should just get in touch with MB and get support and assistance for that.
Should people that are already using something like Ripple be migrating onto the new app, or should they continue to use the app they were already using?
They could do either. There's certainly value in using Ripple, and I've already downloaded that previously on my phone so that I can check in when I get my morning cup of coffee. So I'm not discouraging people from doing that, but I'd encourage them to add our app, and likewise we don't want people to end up having to have a dozen different apps on their phone depending where they are visiting. So a key next step is also to ensure that whatever app people are using, it complies with the standards that we are looking for, and are able to hopefully migrate to using that single NZBN QR code, and then also provide us with the information we might need at a point in time when we're wanting to trace somebody.
If you go into a cafe, will you check in using Ripple and the new app?
I hadn't thought about that actually. I'll probably just do one.
The NZ COVID Tracer app is not a replacement for something like signing in a sheet when you enter a hospitality outlet, is that correct?
At this point in time, that is correct. Just a reminder that retail outlets don't need to keep a record of whether who has been there, but it is our hospitality venues. Remembering that people are going for a period of time, usually to sit down and have something to eat and or drink. So at this point in time, no, the new app, the NZ COVID Tracer, does not replace that requirement. But with the new functionality that comes along, the intention is, of course, then to be able to release hospitality venues from having to keep a manual record of people. There's a follow-up question.
Outside of the sort of app realm, but for contact tracing, we've received a number of reports of people intentionally writing false names or false phone numbers on the sign-in sheets at different shops. What's the sort of danger in people doing this, and is it something that you've had any information about?
Well, I think people need to understand what the purpose is of them recording their details, and that is just that if there is a need to trace them, the whole purpose of keeping that information is to ensure that we can do that quickly, and that's there to protect everybody, to stop the possibility of onward transmission. So I just encourage people to be honest, participate, and again, if they've got the opportunity to download the app, that will help them at this point in time to keep a record of where they have been and enable us to contact them should we need to.
Those businesses who are going to stick with a manual system, one that they've already conjured up themselves, are you happy with that, or would you like them to move on to the app?
Well, they need to maintain the manual system at the moment. I think there will be a good incentive for them to move on to the app because it will be simpler both for them and for their customers.
Would you prefer to keep the data from this app onshore? It's being stored in Amazon Web Services servers in Sydney. Was there any possibility of keeping it in New Zealand, or do we just not have the data storage capability?
Well, the Amazon Web Services is an all-of-government server that we've been using since 2017. It was, and you know, I'm very confident in the confidentiality and privacy arrangements around that. You'll also be aware, of course, that there is an intention to build a sort of a cloud-based server onshore in New Zealand that was announced not by Amazon, but by others a week or two back. But no, I'm confident. I mean, a lot of our data is already stored on these cloud-based services around the globe. The fact it's in Australia is neither here nor there.
Guarantee that even if people willingly share this data and say that it's okay to share, that it will never be moved around within government. It won't be linked to the RealMe, Cox, or if you ever see it any kind of way. It will be just for the Ministry of Health, right?
Yes, I can guarantee that, and that's part of the obligations on us to get through the privacy impact assessment. So it will only be used for contact tracing purposes for the COVID-19 outbreak control. Yep.
What about health workers passing on COVID to other members of their household? There is the regime with the ministry for them to get funded temporary accommodation. However, there's several criteria to qualify. Is that criteria too strict?
Well, I'd be interested if it is causing a barrier for some people. I think it's important to have criteria there so that there is a good rationale for doing it. But the option is there, and Cabinet has put money aside for people to be able to have alternative accommodation if they feel, if they're health workers or if they work in aged residential care and they feel that their home and circumstances means that they could be at higher risk.
Have asked for that temporary accommodation, and do you know how many?
I can find the number. I understand it's a relatively small number of applications at the moment, and that may well reflect as much the fact that we have such low case numbers around the country, so people are not seeing that there is a risk.
Health Assembly, and this is a personal question, but I just note the hours are particularly unfriendly to New Zealand. Have you been sleeping at all in the last 48 hours?
I have been, I'm pleased to say, and what I can say is that our participation in the World Health Assembly, whether we are doing it virtually from New Zealand or in Geneva, we're supported by a fantastic team of diplomats who are based at our mission in Geneva, and so they've done what you might call, what would be our graveyard shift through the night, and we keep in regular contact, and we've been working with them in the build-up as well.
Seriously, can I ask about the takeaways from the Assembly, whether New Zealand was fated for its response to COVID-19, but it's not that sort of an organisation, what your takeaways might have been?
Well, I think, you know, one of the things about the World Health Assembly and about any UN body is that it is a forum for states to actually agree on how they're going to act collectively. And there is no more important thing we could be doing that around at the moment than this global pandemic. The impacts not just on health but socially and economically are profound. So I was really pleased to see, and I have seen some negotiations of resolutions go into and sometimes all through the night to get agreement. This one was agreed actually before we started the Assembly, and I think that is testament to the willingness of countries to act collectively, but also the skill of the diplomats who agreed text on a resolution that does have still some issues that where there are tricky things to work through. So I think it's a great example of international cooperation working well.
Has New Zealand grown its mana at these sorts of organisations through its response to COVID?
Oh, I'm not sure. I think we just go there to do our bit, to participate and to contribute. And in fact, even outside of this situation, from my experience again at previous World Health Assemblies, the New Zealand diplomats have a very good reputation amongst their colleagues, and very often I've found New Zealand is asked to play a role in either chairing drafting groups or helping facilitate getting resolutions finalised, because the skill of our diplomats is well known.
What would you say about the political issues that an organisation like that has come under fire recently? Obviously, there's an important operational function that it fulfills, but it is a part of the international political sphere. Do you feel like those politics weigh on the operational day-to-day functioning of the WHO?
Well, they have an influence, but that's not unexpected because they are essentially an organisation of countries. And you'll have heard the WHO Director General talk about this on the question of Taiwan. What his role is to do is to respond to the wishes of member states. So WHO can't make a unilateral decision whether or not Taiwan can be an observer at the WHO. That is up to member states. Yes, all UN organisations are influenced by politics, but that doesn't mean they're not important and that they don't serve a very useful function, particularly in this sort of international global health issue.
And just on back to the app, will the ministry be setting any firm targets for uptake, and if so, what would those targets be?
Oh, well, I just am hopeful that as many people as possible download the app. That will make it, of maximal use to us. And again, just to reiterate, it's complementary to our existing contact tracing capability and capacity. We're hitting the benchmarks around performance at the moment, and this will just give us another option. And I think, especially once these new functionalities come on board, will be useful for individual New Zealanders.
In regards to people writing fake contact details at hospitality outlets, that sort of thing, are they putting others at risk?
Potentially they are. So, I would encourage people to provide accurate contact information and also encourage them to download the app, because that will mean that we have got their contact information and that if needs be, we know where to get hold of them to help manage any risk to them and their families.
What about the app will be picked up enough by the vulnerable populations who might be the hardest to contact trace and might even live in more cramped living spaces where these things where COVID could spread more rapidly? Smartphone penetration is pretty high in New Zealand, but having your data on all the time is not necessarily a thing that a lot of poorer people have.
Sure. So there will be people who don't want to download the app, and I think they will come from across different social groups. We'll be putting some effort into making sure that there is good publicity around the app, and that publicity reaches in through a range of channels into all social and demographic groups.
Already makes things like Facebook and Twitter free on data on some plans. Would you be hopeful that someone like Spark and Vodafone can make all the data that goes through this app just free and not?
Oh, absolutely. And in fact, over the last couple of months, both those companies have made a range of our apps. For example, the new Mentemia app and the data exchange on that. That's the mental health one that Sir John Kirwan has developed. So there is that, and a number of others where they have basically zero rated any data use by people who are using them on their mobile phones.
Had any conversations with, or has the ministry had any conversations with Spark and Vodafone about this particular app?
I'd have to check that. My team have done amazing work on this, so I'd be confident they have left no stone unturned. Any final questions?
Yes. The lockdown.
Sorry.
Okay. Thank you. The lockdown's obviously an extraordinary amount of time in preventing the spread of COVID, but lots of other communicable diseases as well. I'm thinking particularly of HIV and STIs. Advocates say there's a possibility of breaking the chain of transmission. Do you agree? And if so, how can we capitalise on that extraordinary period of time to sort of cap future transmissions, or what would you say to that?
Look, to be honest, I haven't really thought about that particular issue. We've certainly, of course, seen this big reduction in infectious respiratory diseases. And I think one of the things we'll be very interested to look at is what the pattern of presentations to health services is over these coming weeks and months for both communicable and non-communicable diseases. My understanding is that in a number of other countries they've seen quite a significant drop in non-communicable disease outcomes, including, for example, myocardial infarction, strokes, obviously injuries as well are greatly reduced if you haven't got people driving around in motor vehicles or doing other risky activities. So we'll be looking closely at what the patterns of, for example, primary care and hospital presentations are over coming months. That will give us an idea.
Well, are you in a place where you can capitalise on this very unique time to actually understand how best to treat or to study or to know? Do you have resources in place to do this sort of work?
Actually, one thing we are focused on and putting our resource into is capturing and amplifying some of the changes that have happened in the way services are delivered, in particular that use of virtual technologies. Now, clearly not every interaction between for example, a GP and one of their patients can happen over the phone or virtually, but many can, as can many, for example, follow-up appointments with specialists at a hospital. And so we're very interested, and this is where we are putting effort into, is capturing those, locking them in, and broadening their use so that they are part of what the future health system looks like.
Virtual consultation been a little bit problematic for GPs because there's no funding coming into them if you're just consulting virtually. How is that sustainable?
Well, a couple of things there. We've been working with GP leaders over the last couple of months on that very issue. Secondly, they are still able to charge a co-payment for a virtual consultation. Of course, it's not something that people are used to doing. They're used to getting their money's worth by coming in, sitting in a waiting room for some time, having their 10 minutes and then getting a prescription and going. But I think as it becomes more a normal part of our interactions with primary care, that will be less of an issue. But it has forced us to both in the ministry and with primary care to rethink about the way funding goes to primary care so that we can fund and incentivise the most appropriate consultation regardless of how that happens.
So, what's our capacity to quarantine incoming arrivals at the moment, and are there any plans to ramp it up if Cabinet makes any decisions around loosening border restrictions for certain industries or certain categories of worker, that kind of thing?
So my understanding is we've got 10 hotels that are at the moment available to quarantine or put people in isolation in Auckland alone. There also has been a hotel in Christchurch. So we have plenty of capacity. If we were increasing the number of arrivals coming, that would be a part of a broader decision around relaxing border controls. Now, of course, the first one that we're looking at is the Trans-Tasman one with Australia, and we would only do that if we were in a position to not require incoming travellers to quarantine. So I think our focus is first of all on that. But certainly what we've seen is a pretty steady pattern of relatively low numbers of people coming into the country, Kiwis returning over the last few weeks at least. So there's plenty of capacity for that. Any final questions?
Just one, and apologies if you already clarified this yesterday, but in terms of the WHO evaluation, is that looking into the origins of the virus in the initial outbreak?
Yes, I think that's explicitly in the resolution that has been included, and I can imagine that took quite a bit of negotiation to get agreement on.
Expand a bit on that, on the negotiation that was required to get there?
Well, no, unfortunately I wasn't part of them. It would have been fascinating, but there was weeks of basically Geneva-based negotiation to get agreement on the text of the resolution. Final question?
Sorry, back on the app. If it is rolled out, if there is a higher level of uptake and it becomes easier for people to check into places, will you require retail outlets to start contact tracing the same as hospitality, or are they completely sort of off the hook?
Oh, well, I think if you think about the functionality for people as part of their digital diary, I'm expecting retailers to have a QR code for their New Zealand business number. Not because they are required to maintain a record, but because it will be helpful for people to scan, and they can just quickly scan on the way in, and that will keep a record of where they have been. So,
it's a bit confusing with multiple different apps and then manual sign in and then other people using the QR codes.
It could be confusing, but at the moment the thing that isn't confusing is that we have got this app. It is specifically for to assist our contact tracing, and I'd really encourage people to download it onto their phone and to register. Okay, thank you very much.